All right, so I'm going to talk a little bit about pulmonary blood flow and how it has traveled throughout the system. So I'm going to start with the right atrium. So you have your superior vena cava and inferior vena cava that meet up at the right atrium. That the deoxygenated blood is going to go from the right atrium into the right ventricle, then up to the lungs. The pulmonary arteries are going to carry it to the lungs, and then in the capillaries in the lungs, this is where the gas exchange occurs in the alveoli, and the oxygen will be picked up, and the carbon dioxide will be left behind. And then the pulmonary veins will carry the oxygenated blood to the left atrium, and then down into the left ventricle. The blood is pumped to the aorta, and then you have your ascending aorta to your head and upper limbs, and then you're descending to your lower extremities, and then it gets pumped out to the systemic circulation system. So next, we'll talk about Poiseuille's law. Is a description of the pressure of fluid as it travels through a cylindrical pipe. And right here I have, if you can see it, I actually drew airways because we're talking respiratory. So over here, I have flow rate. This is an airway of 1 centimeter, and this is an airway of 0.84 centimeters. So the pressure remains constant, and the flow rate. So if the pressure remains constant, and the airway is dilated to 1 centimeter, then the flow rate is going to be greater. It's going to be great at 16 milliliters per second. So if the airway decreases in size, less airflow will get through, so 8 milliliters per second with a smaller airway. And this is pressure remains constant. So I related this to asthma. If they have a smaller airway lumen, it's going to be less airflow getting through that. And then for pressure, I have at the bottom the flow rate remains constant, and with a 1 centimeter radius, the pressure for that air to get through a bigger diameter airway lumen will be less at 10 centimeters. And then with the smaller airway lumen, it requires more pressure. So I did 20 centimeters of water, so 0.84 centimeters of the airway lumen will require higher pressures. So a decrease in the radius will need to increase pressure to keep the same airflow. And then on the back, I did the lung zones, and I did zone 1, zone 2, zone 3. So right here is the pulmonary artery, and this is going to be at 15 for the pressure. And then down low, for zone 3, you get into higher pressures, and this is where the perfusion is, and where the perfusion is constant. And then up top in zone 1, perfusion is absent, and your pressures start coming over to 3, 2, and 1. And here's the alveoli I put in here, and I just put +2 in all the alveoli. So perfusion is absent in zone 1, perfusion is sporadic in zone 2 through here, and then perfusion is constant in zone 3. And so the top of the lungs will receive more of the ventilation, and the bases of the lungs will receive more of the perfusion. And then next, so cardiac output is the amount of blood that is pumped out by the heart in 1 minute. The normal range for this is 5 to 6 liters of blood every minute. To get cardiac output, you need 2 components, and that's heart rate and stroke volume. And in patients with acute respiratory failure, there is direct correlation between cardiac output and intrapulmonary shunting, and this can be important for ARDS patients. So pulmonary vascular resistance is the resistance in the pulmonary vascular bed against which the right ventricle must pump blood. The normal pulmonary vascular resistance is less than 250 dynes per second. To obtain this, there's a calculation, and it's the mean pulmonary artery pressure minus the pulmonary capillary wedge pressure divided by the cardiac output times 80 to get your measurement. And an increased pulmonary vascular resistance is seen in ARDS patients.